Hello, everyone. Thank you for joining this session on Next Gen DND for medical devices, adapting to AI, digital health, and real-world evidence. We all know that medical device world is changing fast. AI is entering the space, digital health is expanding, and the real-world evidence is becoming a bigger part of how we measure value and safety. With all of that, our traditional ways of doing verification and validation need to keep up too. In this session, we're going to talk about how VNB is adapting, what's working, what challenges we're running into, and how organizations are maintaining the balance between speed, quality, and safety. I would like to announce our speakers for this session. Dilip Kumar, he's the head of software R&D for IGT Mobile Surgery at Philips Healthcare, where he leads multi-site teams developing embedded software, AI-enabled applications, and clinical solutions for global customers. With extensive experience in engineering leadership and innovation, Dilip has also co-founded startups, managed global programs, and driven strategies across embedded systems, AI, cloud, and clinical workflows, all with a strong focus on delivering impactful healthcare technologies worldwide. Next, we have SyedMahid Akmal, VNB Manager R&D at Thermo Fisher Scientific. He brings over 17 years of experience in verification and validation, product development, and engineering across life sciences and technology sectors. Syed has held progressive leadership roles at Thermo Fisher Scientific, Honeywell Technology Solutions, and Mahendra Satyam, where he contributed to complex R&D and technical initiatives. His deep expertise in D&D processes and team leadership supports innovation and quality in life science research and development. I would now like to introduce the moderator of the session, Dhaval Vasavada. He's an associate director at Healthark. He brings over 2 decades of experience in technology leadership and specializing in AI, data platforms, and digital transformation. He has led initiatives across medtech, life sciences, and IT services, driving innovation at the intersection of healthcare and cutting edge technology. Welcome, everyone. I would now like to hand it over to Dhaval. You may now commence the session.
Thank you for the introduction, Shekha. First of all, a good morning, good afternoon, and good evening to everyone from the different time zones who are joining us today. And welcome to today's panel discussion on next gen VNV for medical devices, adapting to AI, digital health, and real world evidence. We all know that the medical device landscape and the technologies behind us is evolving rapidly. Right? Today, devices are not just hardware, they are increasingly digital, connected, and in some cases powered by AI. Alongside that, clinicians, regulators, and patients, they expect proof of safety and performance, not just in controlled labs, but also in real world use. This is where verification and validation becomes absolutely central. It's no longer just a box to tick. It's a critical part of ensuring devices are safe, reliable, and trusted in real world settings. I'm thrilled today to have with me representatives from two leading organizations shaping the future of medtech. Dilip and Syed, thank you both for being here and sharing your perspectives today with us. Okay. To get started, let's dive in with a very broad question I would like to put across. Right. So, from your perspective, what are the biggest changes you are seeing in how VNV is approached as devices become more digital, connected, and data driven? Dilip, maybe you can kick us off, and then Syed, I would love to hear your take as well.
Sure. Yeah. Thanks, Dhaval. So we are in a rapidly changing and evolving environment in the medtech space. As you know, all our systems are connected. All our systems are the technology used in our systems is changing rapidly. The customer base and the needs of our customers and patients is also rapidly evolving because there is a lot of load on healthcare around the world, with doctors and technicians and nurses having a lot of load on their hands. So that puts in a lot of pressure on how high quality and how easy to use systems are brought to the market. And there is also all the evolutions of AR, VR, AI, digital technologies that are here. So that's really changing the way companies like Philips Healthcare are providing or verifying and validating systems in medical space. Few things that come to my mind on changes that are happening. Number one, A lot of data that we are actually getting from our customers, from our post-market surveillance, etc., is now feeding into our VNV and helping us innovate more and faster in a VNV. That's the first one. Second one, automation is changing our VNV in a big way. A lot of manual verification is changing to automation that can help us bring products to market quicker and faster and a more agile way to the market. Third, AI tools and AI solutions are also helping us now in rapidly creating better and more real world examples for our and data for our verification. So AI automation and uh, access to data from our market has been really helping us do our verification faster and with higher quality. I think, yeah, now I think I can share my stage with Syed to give more data.
Yeah, definitely. Again, hello everybody. So it's good to be here. And Dilip got many of the good points there, right? Definitely the changes what we are seeing in V&V with the process getting evolved. I talk more about one process, right? V&V process is, it can be anything, right? Not just V&V. Any development process, be on dot that leads to a better quality of the product, right? And that's ultimately what every industry looks. And definitely as a Thermo Fisher, we are on dot making customers more better and having a better quality of the product. So a couple of things, what I see the changes, what mostly I feel or what we are trying to do over here is the traditional way, the switch between the way as Shika started, introduced the session, right? We make a shift from a traditional way of working to dynamic changes. It's more important, like we try to adapt to the conditions, how the customer is taking the products, how the things happen. That's where the real world data comes into our picture. As some of the things what Dilip tried to cover, definitely it's a data driven world. And any VNV done through data driven, we have more realistic data, kind of knowing what the customer needs. And that helps us to put on a quality product onto the customer, what they're expecting it. Right. So maybe adding on along with what Dilip tried to say, definitely one part is like continuous validation, right? That is something which we go through the real time data. We need to look into it, like how our devices are performing as we go through the real world data, right? And then adding one more thing, as AI definitely is one, what Dilip said. One the last thing what I want to add over here is the technology infrastructure, right? Because we are getting more and more using the advanced techniques. It's important like how we utilize this analyticals, right? It's more about the statistical data. We need to have machine learnings to analyzing all this big data, because RW is very huge one. The data what we get from there is very huge. It's more about how we try to process that data to get a more better shape. The team can utilize that one and can develop have a better VNV execution. So
Yeah.
I just close with that.
Yeah, I want to add one example. So, since I in my business, we are in imaging, we are in surgery imaging, and lot of our verification validation requires real world imaging to perform. And since we work on various modalities, starting from cardiovascular, neuro, orthopedic, urology, oncology, etc., each of these from different parts of the world, the image library we use for our VNV is so vast that we can never cover the entire world and their physiologies. So how we get the real world images that we use for VNV, how we extrapolate them using AI tools and simulations is one of our. That's the real way by which we bridge the gap between the image libraries we use for our VNV and the actual world. And it's a continuous learning process. The more products we launch into the market, more customers we get, and the hospitals we tie up with, our image data increases, and that's how we have been trying. And it's a continuous process of improving our imaging data so that we can also get our verification done as close to our patient as possible. So that's something which I wanted to add.
Yeah, and that's quite interesting because more and more across this 3 days, and even in the articles that we read, we are continuously coming across themes around AI, the speed to market, right, and the use of real world data for continuous improvement. Right? So we'll get into a bit more detail on these themes, right? So AI, as we know, it's not no longer a theme that we can ignore in this day and age. It's
Definitely, that's
just
true. That's true.
it's not just only entering medical devices themselves, but it's also starting to transform the V&V process, right? So considering that, let me ask a question around like how is AI/ML being used to support the V&V process in medical devices, and what are some of the benefits and challenges that you have seen, right? So, Sir, maybe let's start with you on that, and then Dilip can share his thoughts on it.
Definitely, Dhaval, this is a very good part actually, right? As we say that with the integration of this real world data and the AI ML, what we are trying to look around, that has changed the way the execution happens, right? It definitely brings in a different way of doing the things happening. And ultimately, it's as I said in the beginning, right? It's more about the product performance, right? These things we have seen a significant benefits coming out of this one, where we see the accuracy, the efficiency of the product has really increased, and majorly as a medical industry, right, the safety has been really taken to its prime, right? So some of the things what I say as like it's been supporting more in terms of process is, as we started with saying, right, again, data collections and analysis, it's all about the data, as some of the examples what Dilip really gave, right? We need to know this customer very well, right? And the way it's like understanding how the system works, how system usually the customer uses, right? It's more about that one. We try to work in an industry, or we usually in the labs, actually we do executions in the lab, or some of the simulated conditions, or like trying to optimize a little bit more to an operative results. That's where traditional execution is to stop and go on with more like a dynamic way of doing the performing the executions. And having more and more data helps us to analyze, understand, get more into the shoes of the customers, right? Yeah, bigger the data, definitely AI/ML comes from a picture to do more kind of try to predict the outcomes, try to understand the patterns in which the customers are using it, and this will definitely help us in optimizing our testing process, right? And when we say we try to predict the outputs, identify the patterns, definitely there's another concept which we try to talk more about is the predictive modeling, right? There's another way where we try to understand the behavior of the system, right? How exactly the system is working in different conditions, different environment. And because it's not like every customer will be using the same way. You can have numerous examples, or simple example, maybe one person, maybe they use in different environment, different conditions, different labs, right? So it's not necessary all doctors, scientists. If I can take one of the example of laboratory over here is like we kind of try to do some of the simulated injections of temperatures and all those things using simulated inputs, right? We just try to do from 0 to 180 or 100 in a seconds, right? But whereas in the real world, it does not happen in that way. So we need to see how the devices, the main control, the hardware. See, embedded system is all about trying to understand its behavior, and more importantly, we need to understand how does it behave so over the lifetime, right? It's not like one day it works, second day it works in the same way. That's where the predictability comes into a picture. So it's more about continuous data monitoring. That's where I need to understand how well our embedded systems are working perfectly, right? And with this AML, we can AI ML. This helps us really to get aligned how well the system can perform, and that's where the efficiency counts. Talking on some of the challenges, Dhaval, honestly speaking, they did. I mean, I do see a couple of things on that one. The first thing is data quality, right? I mean, as we keep talking about data, that's where I'm aligned more on the data driven. That's we spoke, right? Data driven technologies, data driven V&V. The data is, I mean, the RW data and whatever we get from the real world, they're not really in a structured one. They can be made unstructured, incomplete, or too much sometimes, right? So processing this data can be a little bit challenging in a real world or practical executions. So we need a good thorough systems to make sure that we try to pull out. See, the simple thing what I try to say over here is we have technologies, we have techniques. It's more about how we use them. And that's where the engineering comes into a picture, right? And the engineering it. And that's another element of from the challenge point of view, I can say it's about the regulatory, right? Regulatory is one of the key things especially for the medical. And some of the bodies, I know AI/ML is taking over the industry everywhere, but maybe in terms of high critical or high safety products, may not agree in terms of an AI data evidence is what we try to give. They may not really go with that, and that can be a little bit more challenging. What I have seen in a couple of products is convincing regulatory bodies with AI data what we have.
Right, and that's a very valid and a great point, said, because while AI can speed up things like simulation testing and can crunch data better than a human can, right? But the challenge is ensuring that the rigor is not lost in this process, right? So that way, Dilip, maybe you can
Yeah.
shine some light on how can we make sure that the rigor and patient safety aren't compromised, even if we are using AI to accelerate the simulation and testing.
Yeah. So yeah, we are really we still face a lot of challenges in using AI in the modeling and the simulation space prior to verify. So I want to also talk about how, before we go into verification, right? How we can get an effective verification validation starts from what I think Syed was saying. It's behavior. So understanding the clinical need, we what we call the behavior driven development, right? BDD we call it, which then drives into our verification and validation. So the AI tools that we use for modeling today are still not mature enough unless we go put it through a very rigorous validation process. So we being regulated, all the tools, including AI tools that we use in design, specification, and verification, we go through a very strict validation process. Without that validation process, we cannot even use the AI tool because we use the reports from evidence. So at from my experience, we are just starting to use AI in verification modeling. While we use a lot of automation, AI in verification modeling is still early stage, and we still do a lot of peer review, human reviews of AI generated models and simulations that we use in verification. We are using it for lower complexity use cases, which are like customer service workflows, etc. But clinical workflows, which are patient safety quality focused, we still use manual intervention to verify that the AI generated models are working. Having said that, we still use a lot of them in design modeling. So we use model based simulations, where we use AI for creating our design models, which then feed into data that we use for our verification and validation. So that way, starting from using behavior driven development for creating our design and using model based simulations, and then AI tools the AI tools we use for model based simulation, we put it through a very strict peer review and validation process, and only the ones which are um, close to real world examples are used in our validation steps, verification and validation. So if I compare a percentage, I would say, if I look at, we have, let's say, 10,000 verification validation test cases, I would consider maybe 10% of them we use AI driven models or simulations. The remaining we use a lot of automation, but AI use case is still limited to about 10 to 15%, not more than that.
Yeah, and that perfectly makes sense when the complexity and the criticality of the device is very high, right? It's
Yes.
dealing with patients after all.
Yeah. Having
So,
said that, one thing I want to say is that we, at our unit level, before we go into system, unit level verification, the use of AI simulations and data is very high, because at unit level, we can take the option of errors, which will then at least be caught in system level verification and validation. So there, I would say use of AI tools for simulate the use of simulators and AI tools is much more, maybe 30 to 40% at unit level, 10 to 15% at the system level. And a strong peer review process, a tool validation process, which also is regulated, is the way we manage the risk of AI tools in VNV.
okay.
Just to add on one more thing to that one, it's a very good structured execution what Dilip was trying to say. But along with that, maybe one point I just want to add on in terms of the rigor, what we see in the industry, medical industry. The innovation is on the rock top, right? They are like on the peak, anyways, right? So we need to kind of even try to see how regulatory team is getting engaged with our execution, right? Many times we see that we bring in a practical situation is like we bring in regulatory kind of a midway of project or at the end of the project, right? So we need to make sure that, I mean, like probably as a best practice, we need to have an eye like regulatory is getting engaged right from the beginning and continuously till the end of the product, right? Because they are like as Dilip was trying to see how the low level testing, high level testing, how the AI is getting utilized. But in terms of balancing the innovation and with this rigor, what we are trying to see, their regulatory body constantly getting connected with what we are trying to do really emphasize a lot on the product quality.
Yeah, I want to add, since you mentioned regulatory side, today, FDA is also simply FDA and EU MDR teams, right? They are also, the DECRA is simplifying the processes for regulatory approvals of
That's true.
medical devices, because
Yeah.
all the big tech guys, right? Google, Amazon, Apple, they are also entering, and the life cycle of creating medical devices is shortening. To help people bring medical devices faster to market, regulatory bodies are also enabling faster verification, validation, and regulatory submissions. And this is done in a way by allowing us to shift left in terms of shortening VNV cycles and moving a lot of verification to earlier design and design verification stages, and enabling public use of public data for system verification and validation. So, with public data being available and by allowing devices to shift left in verification, right? We also tried a typical time for my surgery system to come out is 5 years. We are trying to now shorten that 5 years to 3 years. And the only way we can do it is by shortening verification, validation, and regulatory approvals. And so that's where public use of publicly available data and shifting left of VNV is a way forward for speeding up release of system medical devices to the market.
Very good. I agree with that. Yeah.
Okay. So a very good point, right? Where you are talking about publicly available data, right?
Yeah.
So that's the next topic that I wanted to get into, right? So as Syed earlier mentioned, that the devices are not only designed to perform in that controlled environment of labs, right? But they need to work for patients across very diverse settings and diverse environments. So, how can VNV teams ensure that devices work reliably across different real-world settings, right, and patient groups? So, Dilip, maybe you can go first, and then Sayed.
Yeah. So yeah, a few things. One is, of course, reliability is a big topic by itself, but and all our devices go through a significant long reliability test cycle, and so the reliability test design itself is done based on the real world scenarios, which means that all the modalities. If I look at my surgery and interventional procedure space, all the modalities that we support, the typical number of operations performed in a day, number of switch on cycles that is a surgeon does for our system in a typical hospital OR, right? All of these are fed into the number of cycles that we perform. Imaging data that we use from all the modalities is taken from real world imaging data that we receive from hospitals in limited clinical trials, and the number of cycles we perform kind of equates to the entire life of the system. So we compress the real life of a system into the shortened reliability cycles we run, so the imaging data we use, the environments, the number of the types of use, etc., right? Switch on, switch off, etc. The length of a typical procedure. All of these are fed into our AI models, which then create the reliability suite that we need to run for a specific product. So that way, their AI plays a role because AI uses all this data to give us a typical reliability model, which we then run on our system. And yeah, generally, and it's a continuous learning process again. And we simulate the conditions from around the world, including power cycles, US power, US patient sizes, Indian patient sizes, Asian patient sizes, right? All of these feed into our reliability. So yeah, in a way, It's all based on the data that we captured from our current market space. We have more than 10,000 to 15,000 installations around the world, and we get real-time data from all our customers, right, of how they are using. And that data analytics that we perform on the back end is used for continuously improving our reliability. Yes, so
Absolutely, yeah. So that was my next question, right? Like when we spoke about that post-market surveillance, right? How you use that feedback to improve both your V&V processes as well as future product development. So thanks for covering that, Dilip. Said any other points you want to highlight?
Yeah, maybe I just I think so, Dilip called. I mean, as I said, almost like what is exactly needed from that, and even the post-market learnings, they're very critical, right? But in terms of maybe one thing to add on, like how our VNV results try to implicate or try to resemble more like a user use cases, right? Couple of things, maybe one thing what I would try to add to that one is like we do something called as a long-term reliability test, right? And it has really found a lot of I mean, it's really helped in many ways, to be honest, right? The procedure, what we try to do for that one is like once a product is released, right? We're not stopping a project, or we're not stopping our VNV. Let me be more specific. Our VNV over there, right? Even the product is launched, we are out of the project, my team is out of the project, but still we continue running the product in a kind of user environment, like how the user will be doing it. Maybe an example, if you want to take any kind of a laboratory equipment, right? If you're using that one. And we just try to run them in that kind of an environment as close as to possible. Do like how user does it. Maybe daily comes, log in, checks what's trying to change the parameters, trying to trigger something here and there. I run for ages. I mean, not ages, run for months, right? We have done like 6 months sometimes, right? A dedicated one person, maybe 1 hour in a day, they go over there, check into it. Oh, okay, any issues on this one or not? The primary reason for this one is being a VNV engineer, we know it very well. The software is something it skips. Like we know, like for example, simple example, if you want to take a mobile or something, if you don't do PO for like 3-4 days or 5 days, you see the flow slag or slowness into a mobile. A very simple example, right? And we have some of our products which run 24/7, right? There is no power cycles, no resets, and I assume like a product running for almost like 6 months without power cycle. What should be the status of our memory, where it's like RAM or ROM, whatever it is running, how much it keeps growing it. I have a simple example. We had one of the instrument. The customer had kept that instrument for 55 days without running, but powered on. After 55 days, they turned on the instrument and it crashed. Right, so we don't know that's the software for you, right? So that's where we do this long-term reliability test where we try to see what exactly how the memory behaves. It's all about software memory, how it captures, how it does, what it does. Is there some of the features, right? Some of the features, if you see, it works very good to start with, and after a couple of days, and medical industry, as I said, right, there are many equipments which run round the clock. All right, and I assume like something doing surgery, if you are trying to print some your ECGs and all those things, and your printer is not working, right?
Yeah.
So super critical situation, right? So in that way, there's reliability testing, and we make sure that you bring in these use cases when you're trying to do the execution, so that the engineers, what the VN engineers, what they're trying to do, they incorporate these things into their test plans. That's what we try to bring in. And coming to our post-market learnings, there's our report card, right? We want to see like how good the instrument is doing into the field, right? And it's very important parameters, right? We kind of look for a lot of feedback from the instrument, whether how well the instrument is doing. We have a constant, like our service team, our quality team reach out to our customers very often, try to understand like, are they seeing any issues? Are they trying to do something? And we have like kind of creative models also installed, which tries to keep learning by itself. Can we foresee any issues in our products? Before instrument behaves for failure, or before customer sees that one, can we try to predict something if in case happening? That's where the operative modeling comes a lot into our picture. And along with that one, right, is this feedback I just talk about, right? This is very much important, and we need to make a structured feedback loop between the customers, and this should be across actually, right? It's not like just V and V. It comes through R&D, engineering, quality, your marketing team, and everybody who keeps track of the quality of the product. And observations what we get. We need to have a central forum or something. We keep sharing the details, and we have something like that, which really helps us a lot to understand. Oh, okay, we feel like ownership, right? Okay, our product is doing good. We have not seen anything in the last 1 year, 2 years, 3 years. They are doing very good. And if something comes up, we do RCA, understand that one. So this post-market data really helps to build upon our quality, build upon our improvising our V&V steps, our process, whatever we try to do, and then try to incorporate these lessons learned as we go through it in the next progress.
Yeah. Yeah, I want to add one thing here on the data that we get from the field on post market. So when we run long term reliability tests, right, how we manage observations we find during these tests. So during long term reliability, of course, it is not observation free. We find observations and issues during long term reliability. When we see an observation, we have to check the seriousness of that to see whether it is acceptable or not. For that, we significantly rely on post-market data from the logs that we capture from our systems. So all the logs that we get from the system models user behavior of how a system is being used. So if I find an observation during a long-term reliability test, I check, is this scenario likely to happen in a typical day of the. So based on I think millions of logs that we capture, we try to check probability of that being occurrence, and that we use to decide whether shall we go ahead or we stop. And that has really helped us because we can really see how doctors use our equipment, and if a use case that can occur regularly is appearing as a defect in our reliability, we stop our reliability and it has to be fixed before we proceed. So it's a big use that our real-time analytics of logs that we generate is used for ensuring that our long-term reliability tests are observations are managed efficiently. So that's it's very useful for us.
And that brings to the front a very important point, right? Like all this post-market surveillance, the improvement of verification and validation. So it also means that V&V and R&D have to work more closer together earlier from very beginning in the life cycle of the product development, not just at the end, right, when issues are harder to fix. So, what, according to you, Dilip, how do you see that collaboration evolving in the organizations?
So the involvement of verification and validation teams starts from the like any other group, right? It starts from the time we identify the clinical needs, from the clinical user needs that we get from our marketing and our clinical experts, right? The doctors who work with us. From that point itself, our verification teams are involved in the, so we call it design for testability or design for verification, right? That's so the early involvement of verification teams in the creation of our user, when the user needs are created. From that point, we also create our user interaction designs of our entire product, which includes mechanical, electrical, and user workflow. All of these are reviewed. Every step of the time is reviewed by our. So to me, handshake of every step, starting from requirements, specifications, design, and unit verification, the traceability of that is the VNV is a real part. So uh, like in the regular V cycle of development, right? VNV, while it sits on the right side, the input of the verification team is at the left side of the V. And that's where I wanted to talk about behavior driven development, because when we do behavior driven development, verification tests are in a way an input to our behavior that we create in our user specific. So if you do BDD very well from specification, it helps BNV get done faster. That is the way we partner between BNV and start and R&D. So R&D, in a way, verification is kind of mini part of R&D itself. So,
Yeah, good point. Good point. So now thinking about the future, right? We spoke about like AI technologies, then predictive modeling, simulation. Right? So if for the next generation of VNV experts, right, what skills do they need to bring to the table, and what are the immediate requirements? If you can lead us off on that.
I mean, It's important, right? Definitely, when we try to understand the need and stuff, we need to understand the competency development, what we need to catch up with the high-paced world. But one of the things which comes to my mind, top of my mind, is the data science, right? That data, it's the more the data, as I said in the beginning, right? The more the data you have, you're in a better position to understand the system, understand the capability of your system, understand the user. See, as a V&V engineer, it's more important. We try to see, we are different engineers, right? I mean, V&V engineers, like we have, as Dilip was trying to say, our BDD guys who try to do more at the low level, at software level in this. We have like kind of system guys or user guys, user acceptance guys. They need to wear those hats, right? When we are doing like more low level executions, try to understand how well my software is doing, all right? And you go up the ladder. V model was a really very good example, right? Go up the ladder on the V. Being a system guy, you need to know, or you need to think out of the box, trying to understand how the user will be using it. That's one prime thing. And second thing is the I should say about the performance or the stability of the instrument of instruments, right? So that comes with your stress testing. And to understand the stress testing, you need to understand the load of that one. And for the load, you can't go with the traditional way of execution. You have to definitely get through with the data, understand the real-time data, how use, as I said, you right. One of the example, customer was keeping my instrument for 55 days without doing anything, just powered on. Out of 55 days, we saw that instrument crashed. So you don't know, right, how exactly the system user is using it. So that's where your real-time data comes from a picture, how that are different. Again, as I said, the different users are there who use it differently, right? So definitely one of the skill, what I say is data science, which is definitely a very high skill set. When I say data science, definitely we need to have some machine learnings or kind of an AI methodologies which they can handle the huge data. So as I said that, and when during my early days, one of my senior, they told me, we all know how to use the tools, we all know how to Google and everything. The important thing is what to Google, what to use, how to use, right? So we have the lot of data, but how to process that data, what to pull out from that one, the accuracy, the precision, that is more important. So we need to look for some kind of methodologies, develop what are the standard methodologies we have to handle this high data. And then another one or two things what I can talk about is my favorite regulatory. Right? People, V&V team needs to know what regulatory demands. Right? Many cases we see that we do everything, we cover everything, and then at the end of the cycle we get a mail from the regulatory. Have you covered this one? How did you justify you have tested this? Right? Then we run back. In some cases, we run back and see, oh no, we are not. Let's do it. So V&V team, and just like old days, I'm trying to say, now it's really team. We have brought up that kind of an awareness as we discussed earlier, right? Right from the day one of the project, getting your CTQs, understanding it, requirement. We have dedicated session where we try to look what regulatory demands. So regulatory fluency is one of the prime skill set also I can say, which V&V engineers needs to have. And then last but not least is cyber security. Right now, cyber security awareness is very much prime, right? With more of a connected device. Now we are saying with again IoT was something like 10 years before was kind of around everywhere, and that has become one of the basic thing now. And I'm definitely down the line some days AI will become the same shape, right? It's already, but yeah, I should say definitely it will become one of the must or basic competencies. That's I'm not taking AI now, but yeah, that's one of the important thing. But cyber security awareness is very important because multiple connected devices, we have wearables, doctors are using a lot, different patients are using it a lot, right? And there's very easy way for the cyber guys to get into our systems. So people, V&V engineers needs to have some awareness around the cyber security too, to make sure that our system is not vulnerable for any of these things.
Great point there.
Yeah.
Dilip, anything to add on that?
Yeah, I think what I wanted to say, I think Syed, you have mentioned most of the important points for the future. The thing, as I mentioned earlier, right, our future is going to be shortening our introduction cycles for products, which means our future VNV engineers have to be ready to reduce the time we spend in VNV so that we do not miss anything and the quality and the safety and security of the product is still sacrosanct. So I think today's verification engineers have to really, or in future, we have to move away. I think they are going mostly. I think the VNV engineers will evolve into real technologist members, right? Who understand modeling, they understand AI, they understand automation, they also understand the real customer need. So to me, more than the actual verification process, customer knowing the need of the customer and the product. So in a way, our VNV future VNV engineers have to be real product managers, I would say, who are experts of the product first and technocrats, because we have to reduce cycles, which means automation, modeling, AI, and tools for speeding up will be the key. So to me, if you are in 10 years from now, if you want to be a verification engineer, I think you have to learn the product. I think today we are saying, right, because of AI, software engineers tomorrow have to now become system engineers, because AI will do your coding for you. But if you do not write your system specification well in the prompt, the code is going to be wrong. Same way for verification. All verification engineers to me have to learn to be system engineers in the way understand the system well and have all the technologies that you use to speed up your verification. So otherwise, you are going to be obsolete. That would be kind of my message.
Okay, great.
That's fair.
Yeah. So, in the interest of time, I see one question from the audience, which I also had in my mind to ask both of you.
Yeah.
Right. So, it's that in the next, what is the most critical shift VNV must make in the next 5 years to stay relevant in an AI-enabled and an RWE-driven medtech world?
Yeah.
So,
Yes.
maybe Dilip, you can.
Yeah. Okay. Yeah. So to me, it's about continuous improvement. To me, two things that come to my mind on what we need to take care for stronger verification validation. One is the continuous feedback loop. Getting data from the customer to improve the verification process. Number one, which includes the data, the need, understanding the use cases of the customer, and third and second one is real world usage. How can you mimic the verification validation as close to as possible to the real world? So real world and getting data from customer data. These two to me are two shifts that we really look forward to improve verification in the future. Yeah.
Said your thoughts on that.
Those are big points. I think it covers everything, to be honest, right? So maybe just I can make one liner over there is, as I started in the beginning, and I just uh, it's a mindset change, right? We need to bring in, we need to see that how can we uh, get on with more dynamic and adapt, continuous change in a process, right? We need to get evolve with the changes, the data, as I said, real-time data. We need to have a process be more dynamic, needs to adapt according to the whatever the how the system behaves, how the market behaves, what trends comes in, market trends are coming in. So we need to align with that one. So we need to move from a traditional way of working to a more like a dynamic and adaptive approach where, as I said, process lays down everything. That's more the stronger the process, and the more the better or the best is the quality. So yep, along with all the, as Dilip said, along with that, it's more about the process getting moved from the whatever we are trying to do, a classical way of working, that needs to change to an more AI based or real world time, whatever we're trying to have, better understanding to make more systems reliable for the users to use and have a good safety there.
Great. Thank you. That has been a very insightful conversation. We could go on and on. It's quite an interesting topic, but we have a limited time slot, right? So, uh, as a closing remark, what I would say that VNV is no longer just about compliance, right? It's about building trust in the next generation of medical devices. So
Yes,
thank
yes,
you
yes.
both of you for your insights on this topic. On behalf of everyone here, thank you for joining us today, and thanks to our audience for being part of this conversation. Thank you.
Yeah. Thank
Thank
you very
you.
much, Dhaval, for the time today. Yeah, it has been a great experience. Thank you very much.
Yeah.
Good
Thank
evening.
you all. Thank you, Dhaval.
Thank you all.